Alright, today we're going to be doing an examination of the eye. You get to just sit there comfortably while I run a bunch of tests, okay? So first I'm just going to do an inspection. I'm looking at your eyes, your eyelids, your eyebrows. I'm looking for symmetry. With your eyebrows I'm looking to make sure that they curve away from your eyes. I'm making sure that your blinking is symmetrical, so can I have you blink pretty slowly for me once? Okay, they look very good. Next, I'm going to be using a pen light, and I'm going to just be looking at the whites of your eyes and the pupils. So I'm going to just go from the side here, just making sure that the whites of the eyes are nice and clear, which they are. Alright, next I'm going to just pull down, I'm going to do the same thing, except I'm going to pull down your eyelids and look at the sclera and the conjunctiva. So I'll pull these down, make sure that the sclera is nice and white, which it is, and the conjunctiva is pink, which it was. I'll do that to the other side here. Very good. Alright, so the next thing I'm going to do is I'm going to just take the same light and I'm going to point it right at the glabella. And what I want you to do is just stare off into the distance. I'm just going to make sure that I see this light equally in both eyes at the same spot. So can I have you just like look at my finger, maybe? There we go. And the light shines very brightly right in the center of both pupils, very symmetrical, which is good. The next thing I'm going to do is just take this pen and I'm going to do what's called a figure H pattern. We're testing the muscles of the eyes. So I'm going to just have you keep your head still and follow the pen with your eyes for me. Very good. And there's no lag or anything of the eyes, which is very good. Everything's nice and healthy. The next thing that we're going to be examining is what is called perla, which stands for just making sure that your pupils are equal, that they're round and they react to light, and that they accommodate. So first of all, I'm just observing the eyes. Both pupils do look very round, very symmetrical to one another. So the next thing what I'm going to do is make sure that they react to light. So I'm going to cut off halfway and shine the light, and the pupils constrict, which they should do, and look to the other side, shine the light in that same opposite eye, and the other side constricts as well, which is very normal and healthy, and I'll just do it to the other side just to compare. Good constriction, look to the other side, constriction of both as well. Very good. Alright, so the next thing I'm going to do is just assess the lacrimal sac. I'm just going to be putting some pressure. Just let me know if you feel any discomfort at all. And I'm just going to also taking note to see if any exudate comes out of the puncta. So, lacrimal sacs, any discomfort there? Alright, everything's nice and normal. Alright, the next thing that we're going to do is called the cover uncover test, and I'm going to be giving you a piece of paper, and I'm going to have you look off into the distance. I'll focus on one thing, and then cover your right eye with this paper for me. Focus in the distance, and then uncover it for me. And it should stay exactly looking at it where it's supposed to. And it does, so that's good. So we'll move to the other side, same exact thing. Hold it there, and remove the paper. Everything's looking very well. So the next thing I'm going to be doing is standing behind you to make sure that we're going to test your visual acuity, and you're going to see two fingers on either side of you, and I just want you to raise your hand when these two fingers come into view on either side, okay? So you'll be raising both hands as you see them. Alright. So
raising both hands?
Yep. Can you see this here?
Mm-hmm.
Okay. So let me know when you see them. And that is for testing peripheral vision. Everything looks very well and normal. The next thing I'm going to be doing is looking into your eyes, okay? So I'm going to taking my ophthalmoscope, and I'm going to have you just stare straight ahead. I'm going to turn the light on and shine it at your eye, looking at a little bit of an angle to the medial aspect of the eye, and place my hand on your forehead so I know where I'm at. Start about 6 inches away. I'm looking for that redness, that red glow of the eye. I get a little closer and I can see the arteries inside the eyeball and the cone, or the disc, excuse me, and it looks very nice and healthy. Do the same side to the other side. And that looks very good as well. Alright, I would normally finish this exam by using the Snellen eye chart, but we do not have one available. So what I would just have you do is stand 20 feet away from this chart, cover one eye up at a time, and read the smallest line of print possible that you can see. I would record your visual acuity according to the side of the chart, and then we do the same with the opposite eye. But other than that, that concludes our portion of the eye exam.